So we have room if we need to go to a full tablet.
I did want to talk about the medication though because I don't want to do this. It's almost worse than the tumor itself.
What kind of symptoms did you have?
I'm not able to drive until like much later in the day, like 24 hours after I take it. I've been dealing with a lot of like vertigo and dizziness, and I can't even exercise anymore, which sucks because I used to love that. Moving too fast, like turning my head too fast, I start to feel like I'm gonna fall or something, and I drop things pretty often.
So did he talk about other medications or other options with you?
I asked personally about surgery because I just want it out, and he did explain that there's a risk of, that damaging my pituitary gland, and I understand that. I would rather be on hormone replacement therapy if that were to happen long term than to be on this medication long term. I feel like hormone replacement is something that is more common, and people have hormone deficiencies every day, but there's no such thing as a medication deficiency. So that's kind of where I'm coming from.
Because prolactin, we have two medications that it responds to. The other medication, I would not recommend doing that because that has more side effects than cabergoline. It's an older medication. I would usually send you to at least have a consultation with my neurosurgeon who also has in the pituitary clinic. I'm not saying that you're going to get surgery, but I'm saying that, you obviously without me asking you understand the risks.
Yeah.
And the benefits of what this means. And I think like in my practice I've actually been, I think Dr. Lee was 1 year in the fellowship, but I've been at the Cleveland Clinic here for 10 years. So, I've seen a lot of prolactinomas, and in younger women with tumors that are resectable, where there is a chance for complete surgical cure, and you're intolerant to the medication, that in itself is a reason to, have surgery. I think now that it's done, it's important to continue to stent on it because that also shrinks the tumor. It might make surgery a little bit easier. Cases like this where he's taken it out, so I'm not concerned. But if you wanted to, if you wanted to medication, I don't think